some of the combinations that have been looking very promising in AML so far, and I'm biased, obviously, working with Courtney DiNardo and working on the IDH1 inhibitor combinations of ivosidenib in combination with azacitidine and venetoclax. I think the triplet combination in that setting leads to, hopefully, we presume, quicker responses, deeper responses, which translates into more durable remissions, and is also attacking different leukemic clones. Like I mentioned, IDH1 and IDH2 mutations appear to be, very ven sensitive to begin with. However, there is differences between the two. IDH2 seems to be more sensitive to venetoclax in combination with an HMA compared to IDH1. And so I think the IDH1 inhibitor really does augment that treatment approach in that genomic subgroup. I also think emerging combinations with FLT3 inhibitors, AZA plus venetoclax with gilteritinib or decitabine with venetoclax and quizartinib are exciting combinations, especially for our older and less fit patient population that maybe can't tolerate the standard of care approach of an anthracycline and cytarabine-based combination with a FLT3 inhibitor added to it, even though, we do now have an FDA approval for quizartinib in patients over age 60 with FLT3 ITD mutated AML. But I think we know that venetoclax combined with FLT3 inhibitors is a very potent combination. We know that FLT3 inhibitors can downregulate MCL1 expression levels, which is a known resistance mechanism to venetoclax. And so I'm excited about those combinations. And then lastly, I think the menin inhibitors, we have a new first-in-class drug, revumenib, that appears to continue to show promising results in early phase 1 and phase 2 studies. It's now being, that was as monotherapy. It's now being also tested in combination, I believe, along with other menin inhibitors with azacitidine and venetoclax. And so the idea is that, since AML is very heterogeneous with respect to different clones, leukemic clones in the bone marrow, that while some clones may be sensitive to the AZA-VEN component, other clones may be more sensitive to, the targeted therapy, whatever that partner is, targeted therapy plus HMA, or even targeted therapy plus venetoclax. And so I think the field, it's an exciting time in the field to see where these triplet combinations go.